Welcome to VD International Academy, one of leading academy in training nurses and nursing competitive exam as well as IELTS and NCLEX and OAT training. So today, what topic we are going to discuss? So we are discussing very important topics which is already asked in the previous year question papers, right? In the same way, in Magic Pill session, today we are going to start with very important topic, that is oncology and chemotherapy. See, most of the students used to skip these topics, right? Because because of unawareness, whatever it is. But from this area also, most of the time we are giving the questions. So how to focus on oncology and chemotherapy also. Okay, so today's session, it is going to be on these topics only. Let's begin the session. So those who not subscribe the channel until now, please subscribe the channel. And if you like the video, please like it, share it to others also, so that it will be useful for others. Okay, so the first question is, which of the following is the most important tumor marker to diagnose carcinoma of ovary? So as usual, key point here is tumor marker to diagnose carcinoma of ovary. Okay, so in this area only we need to focus. So let's see the option. They are asking the carcinoma tumor markers of ovary. 4 options they have given here: HCG, CA125, that is carcinoma antigen or cancer antigen 125, serum alpha fetoprotein, human placental lactogen. So 4 options they have given here. Among this, the right one is option B, that is CA125. Okay, so the tumor marker to diagnose the carcinoma of ovary is CA125. So what is tumor marker? See, we are keep on hearing the word tumor marker, tumor marker. So what is the tumor marker? From where it is secreted? And if it is secreted, means where it will be present. So those questions should come into your mind, right? So let's see the answer for those questions in this rationale. See, tumor marker, it is a substance synthesized or released by the tumors, cancer tumors. Okay, and where it will release? It will release in the blood, urine, or other body tissues. Okay, and it serves as a biomedical or biochemical marker for the cancer. While you are withdrawing the blood or taking the urine sample, we have to check for the particular what? Tumor markers. If it is present, the particular tumor marker is present, means the person is suffering from that particular disease. For example, in this question, they are asking the tumor marker of ovary, and the answer, what I said, is CA125. And during the blood investigation or urine investigation, they will be checking for what? This particular tumor marker for diagnosing whether the person is suffering from cancer ovary or not. Okay, so on the whole, tumor marker is the one which is secreted by the cancer tumors, and it is used as a biomarker to check whether the person is suffering from the particular organ cancer or not. Okay, so this is the rationale behind this. Okay, so there are different tumor markers. So these things are very important related to tumor marker. So for ovary tumor markers, breast tumor markers are frequently asked question in the exams. Okay, so you should know all the tumor markers in detail. Okay, fine. So for example, if you take the first one, lung cancer, suppose the person is suffering from lung cancer. So here also CA125 tumor marker has to be assessed. Apart from that, one more tumor marker is there for the lung cancer, that is CEA. Okay, carcinoma embryonic antigen. CEA means what? Carcinoma embryonic antigen. Okay, and breast cancer means again CA125, carcinoma embryonic antigen, and human epithelial receptor, human epithelial receptor 2. Okay, HER2 means. Okay, and next one is liver cancer. If the person is having liver cancer, means what tumor marker you have to check? You have to check for alpha fetoprotein. In case of stomach cancer, carcinoma embryonic antigen. Colon cancer, again carcinoma embryonic antigen. Pancreatic cancer, CA125 or carcinoma embryonic antigen. Ovary, again CEA and CA125. Prostate cancer, prostate specific antigen, PSA. Okay, testicular cancer, alpha fetoprotein and HCG, human chorionic gonadotropin hormone. Okay, so these things are elevated, means mostly these things should not be there, or it should be in the minimal amount. These tumor markers should be in the minimal amount, or it should not be there. But if it is present in the higher amount, then we can conclude that the patient is having what? Some kind of carcinoma. And then they, according to the findings, they will be go and find out which organ or which target organ is having the cancer. Okay, guys. So tumor markers are very, very important in order to diagnose the cancer. Please make sure that. Okay. So the next one is, which examination should be performed at the regular basis by middle-aged male person? This question asked 2 times in the exams. Very simple question, same like breast examination. Here also, a middle-aged male person should examine for what on regular basis? This is the question. Okay, direct question. And here they have given 4 options like blood sugar, serum creatinine level, PSA level, that is prostate specific antigen level, serum cholesterol level. A middle-aged male person should assess for what among these 4 options? And here the right answer is what? Option C, that is prostate specific antigen. Okay, a male middle-aged person should assess for what? Prostate specific antigen. Why? See, the person whose age is 50 or above, frequently this type of assessment has to be done in order to detect the prostate cancer. It is very common among the middle-aged males, right? So in order to identify the PSA, that is prostate specific antigen or prostate cancer, we have to do the proper assessment of PSA. To find out the prostate cancer, we need to assess the PSA, prostate specific antigen. The normal value for PSA is less than 2.5 nanogram per ml. If it is more than 2.5 nanogram per ml, then it shows the person is suffering from what? Prostate cancer. So for prostate cancer, which is the tumor marker, what we are supposed to assess? We have to assess for what? PSA, that is prostate specific antigen. Next question is, when assessing a patient with abdominal pain, the nurse should assess. This is also direct question. This time, all the questions are mostly direct questions only. Okay. So understand the question. While examining the patient with abdominal pain, the nurse should assess. Okay. Any quadrant first, the symptomatic quadrant first, the symptomatic quadrant last, none of the above. We should not assess at all. Okay, fine. So among this, which is the correct answer? So before that, you all know that how many quadrants are there in the abdomen? 9 quadrants are there. Okay, so let's start from here. You can see the image very clearly. Right hypochondriac, epigastric, left hypochondriac, right lumbar, umbilical, left lumbar, right iliac, hypogastric, left iliac. These are all very basic things. Hope everyone knows about this, right? So totally how many quadrants are there? 9 quadrants are there, right? Fine. So here the question is, the patient is having pain in some quadrant. So that quadrant, when we have to assess, in the beginning or in the last, or we should not touch? This is the question. Okay. So here the right answer is what? Option C, that is the symptomatic quadrant has to be assessed in the last. We have to assess the symptomatic quadrant only in the last. See, very important question. Even though it is a simple question, many students will make the mistake here. Okay, fine. So the rationale behind this is in order to prevent the Gording sign. Why we need to assess the symptomatic quadrant in the last? To prevent the Gording sign. So what is Gording sign? See, symptomatic quadrant means the patient is having pain in that particular quadrant. Okay, for example, we can take the patient is having pain in the left hypochondriac quadrant. Here, this area. If in the beginning itself you are palpating this quadrant, means what will happen? The pain will aggravate. It will cause what? Rigidity of the muscles. All over the abdomen, rigidity of the muscles will take place because the pain is aggravating and it leads to what? Rigidity of the muscles. So rigidity I am saying, right? So that is called as what? Gording sign. Gording, G-U-A-R-D-I-N-G, Gording sign. It is to prevent the further damage of the particular area. Okay, fine. So in order to avoid this Gording sign, rigidity of the muscles, we need to assess the quadrant, affected quadrant in the last. Is that clear, guys? Yes, always affected quadrant has to be assessed in the last. Okay, fine. So the next question, which of the following is the significant component of pain assessment? You are assessing the pain. In that pain, what are all the significant components? So 4 options they have given here, like cause, intensity, effect, and causative factor. Among this, the significant component is intensity. What is that? Intensity of the pain, severity of the pain. Actually speaking, pain assessment, the significant components are 5. 5 significant components are there. Okay, all the direct questions, you know, it might be a memory based question. Mostly direct questions or memory based question. Please remember that. So by seeing the question itself, you should get the answer. Okay, so what are the 5 significant components of the pain? Here you can see the first one is intensity, that is severity. The next one is duration, how long the pain is there for the patient. Third one is location, the area of the pain. Fourth is characteristic, what type of pain the patient is having, whether a cramp type pain or pricking type pain. So what type of pain the patient is experiencing. And the last one is aggravating factor, which factor is increasing the pain, whether changing in the position or palpation. So which is increasing the pain, aggravating the pain. So these are all the significant component of the pain assessment. Please remember this. Okay, guys, fine. So the next question is, all of the following cancer have infective etiology except. This is a except question. Always except question, no question, not question. You have to be read carefully. Okay, mostly what we will do, we will forget the except. Okay, so you should not do that. Please read the question at least 2 times and understand what is the question is. So this is also a direct question. All of the following cancer have infective etiology except. Okay, so let's see the options. Squamous cell carcinoma of penis, squamous cell carcinoma of lungs, Burkitt's lymphoma, Kaposi sarcoma. Among these 4, which is not having the infective etiology? This is how we have to understand, which is not having the infective etiology. Okay, among this, the right answer is option B, that is squamous cell carcinoma of the lungs. It doesn't have any infective etiology. Clear? Yes? Fine. So why? Why squamous cell carcinoma of the lungs doesn't have any infective etiology? What does it mean by infective etiology? The cancer happens because of some infection. Okay, because of some infection. Okay, so among these 4 options, which cancer is happening because of without any infection? Without any infection. So we selected the option B, that is squamous cell carcinoma of lungs. So let's see the rationale. Why squamous cell carcinoma of the lung is not having any infection? Without any infection, there is a cancer formation. It is because the squamous cell carcinoma of the lung is developed because of smoking. It is not happening because of infection. It is happening because of what? Smoking. Clear? The next one is squamous cell carcinoma of the penis is caused by human papilloma virus, an infective virus. It is very commonly seen among uncircumcised men. If the person, then circumcision means the chance of getting this squamous cell carcinoma of penis is very, very less. The next one is Burkitt's lymphoma, very commonly seen among the non-Hodgkin's lymphoma. You know about Hodgkin's lymphoma and non-Hodgkin's lymphoma, right? The lymphatic tissues are affected in the Hodgkin's and non-Hodgkin's lymphoma. Okay, the classical sign of Hodgkin's lymphoma is Reit-Steinberg cells. You can see that cells. Whereas in non-Hodgkin's lymphoma, it is mostly affect the B and T lymphocytes. There will be mostly changes in the B lymphocytes. Okay, and Hodgkin's lymphoma is contagious, whereas non-Hodgkin lymphoma is not contagious. So these are all the key points you should supposed to remember whenever the word Hodgkin's or not Hodgkin's is coming into your mind. Okay, fine. So this Burkitt's lymphoma is a type of non-Hodgkin's lymphoma caused by Epstein-Barr virus. Okay, mainly affect children in between 5 to 10 years, guys. The last one is Kaposi sarcoma, very simple one. Most of the time, this Kaposi sarcoma, Burkitt's lymphoma asked in the exams. Okay, so Kaposi sarcoma is most commonly seen among which patients? HIV patients. Okay, so it is a disease that involves the endothelial layer of the blood and lymphatic vessels. Okay, guys. So by keeping all these rationale, we can conclude that squamous cell of the lungs is caused because of the smoking, not because of infection. That's why we selected this option. Hope everyone understand the concept, right? Fine. So actually, this is the part 1 only, oncology. In the next part, we are going to discuss about oncology and chemotherapy drugs. Okay, so please watch the video till the end. This part 1, after completing this part 1, please watch part 2 also. Okay, so that we can make a justification or connectivity between the oncology and chemotherapy drugs. Okay, guys. So hope you understand all the concept. If you have any doubts anywhere, drop your message in the comment section, guys. All the best for your upcoming examination. Please watch part 2 videos. If you like the video, please like it, share it to others also. And if you doesn't subscribe so far, please subscribe the channel. Okay. Thank you very much.